All right, let's get to some health news this morning. With people social distancing and socially isolating, there's no better time than now to talk about suicide. Asante's health expert Beth Coker sits down with Asante Resiliency Program Coordinator Jennifer Ndalmia to discuss suicide prevention.
And Jennifer, suicide is a major health concern in the United States, and due to the COVID pandemic, we have seen suicide rates on the rise. What are some signs or red flags in a person we know who might be contemplating suicide?
Some of those signs can be things like saying, "I wish I wasn't here anymore," or researching ways to die. People sometimes express deep shame, sadness, or hostility, and they talk about being a burden to others. A definite warning sign is purchasing guns or talking about weapons a lot, or some of that increased risk-taking, like more use of alcohol and substances, recklessness, showing rage, or talking about seeking revenge.
Are there factors that contribute to suicide or suicidal thoughts?
Yes, definitely if you've known someone who's died by suicide, or you're in your own psychiatric crisis with severe symptoms, that's a definite risk factor. Anytime you face a life crisis, like loss of your job, home, or a loved one or pet, and that social isolation is a big risk factor.
And that's where we've seen the COVID pandemic have such a major impact on suicide rates. If someone we know is contemplating suicide, or we suspect that, how do we get them help?
Directly to say to them, "I'm concerned about you and want you to get help. Are you thinking about suicide? Let's get you to somebody right away." That can be a referral to a crisis line or a local medical or mental health professional.
So is there a crisis line that anybody can access 24 hours, 7 days a week?
Yeah, the counties both put out crisis lines 24/7, and there's also national crisis lines.
And how is Asante helping people who are considering suicide or that risk?
We're really here to involve you with your protective factors. So making sure you get the connection to mental health services and responding to mental health complaints.
Jennifer, Beth, thank you so much. We know that asking the question directly if somebody is thinking about suicide is so important. Of course, if you or someone you know is thinking about suicide, there is help available. Call the National Suicide Prevention Lifeline at 1-800-273-8255. We'll be right back.